You're listening to the Chiropractic Connection, a podcast by chiropractors for chiropractors. This month, we would like to recognize the importance of mental health. As chiropractors, we know that our physical health impacts our mental health and vice versa. We must help our patients find that equilibrium. In today's episode, we will get to learn from an expert in certified Neuro-Emotional Technique. So just sit back, relax, and let's get connected.
Have you ever wondered what makes chiropractic? We don't always have the answers, but it never hurts to imagine.
Welcome everybody, GCA. It's Mental Health Month, Philosophy in Action, and we're going to talk about how to get so many more people thinking positive, looking at the world in a whole different light. Listen, you and I all know this. We all know this, that there are so many people suffering mentally, physically, worried, scared, in pain, suffering, lost. And what I love about being a chiropractor, and you love this too, come on, you see people all the time, they start getting your care and their outlook on the world changes. And the thing is that we don't talk about that enough. We talk about people's pain, we talk about people's backache, we talk about people's stress, we talk about all this stuff, but we don't talk about how consistent, steady, lifetime chiropractic care, we call it lifestyle care in the world of the 100-year lifestyle, that people that are under lifestyle care are just happier people. They're more optimistic. If you ask people who have been under care for a year or 2 or 3 or 5 in your practice, which I hope you have those people. If you don't have those people, we definitely need to talk. If you go back and you talk to those people about how their life is different since they started utilizing chiropractic care as a part of a lifestyle, every one of them will tell you that their life is better, that they're happier. And you know, we had something interesting happen the other day in our office. We had a woman who's been under chiropractic care, maintenance care, she calls it, maintenance care. I can't stand that word, it drives me crazy. But under maintenance care. And she said, you know, I go in, I said, how often do you get adjusted? I asked her. She said, I go in every 3 weeks. I'm a weightlifter, I push a lot of weight, and you know, I really need to go. And I said, so let me ask you a question. You go every 3 weeks, you're a weightlifter. When you go in, do you feel like you need it? She says, oh yeah, man, I look forward to it because I really need it. My body's hurting, my body's sore. I said, listen, time out for a second. This is the 100-year lifestyle way. This is philosophy in action. I asked her, I said, well, how would it be if you didn't need it? Like if you went before you needed it and you never felt like you needed it, would you like it better? And she said, wow, I never even thought of that. I've just always been told to maintain it. It's kind of interesting that your practice is a reflection of what you teach. If you change what you teach, you'll change your practice. It's really quite that simple. We see it all the time with people that we work with all over the world. And so she adopted that principle. She said, you know what, that really makes a lot of sense. And I asked her the question, I said, well, let me ask you this. At 3 weeks, you feel like you need it. What if you went every 2 weeks? She said, wow, that would be better. I said, okay, well, that's a better way. That's lifestyle care. That's performance-based care. That's aligning how you utilize chiropractic care as a part of a lifestyle to support the lifestyle that you choose to, that you want to live. And it's amazing how the common sense of that for this person who is in her 50s, she wants to live a healthy, long life. She wants to live an active life. And it was just like right between the eyes. It made so much sense. So guess what? That's what she's doing. And she's moving forward and she's excited about it. And we see people all the time when they change their perspective. We reframe their perspective because listen, if you want to live an active, healthy, long life, you don't want to be in pain every 3 weeks or every month and feel desperate like you need it. So get ahead of it instead of always being behind it. We tell people that all the time. Get ahead of it instead of being behind it. And so we want that for you. We want that for your community. Think about how the positivity, the mental health in the world would change if everybody was under chiropractic care. If they stopped taking drugs, if they stopped taking pills, if they stopped hiding their symptoms and covering up the symptoms and got to the cause and got their body functioning at its highest level with a healthy spine, a healthy nervous system, a healthy brain, every cell getting messages the way that it's supposed to. Come on. I love it. You love it. If it's good enough for you, it's good enough for them, at least as an option. So listen, apply this principle, philosophy in action. We tell people also all the time, you've heard me say this, that your innate intelligence will organize around the thoughts that you think, the choices that you make, and the lifestyle that you live. So make 100-Year Lifestyle healthier choices with your ideal health and longevity in mind. And you will see your optimism skyrocket. Your body will function at the highest level that probably it's ever has, regardless of your age. So listen, my colleagues, the world needs us more than ever. So glad to be a part of GCA, to be contributing in this way to you. Don't hesitate to reach out. They're doing great things, by the way, at GCA. The politics that they're working on over there, the PAC. If you're not in the PAC, join the PAC, contribute to the PAC, show up at meetings, meet some brothers and sisters. There's a lot of great energy happening over there, great new leadership. So hope to see you soon at an upcoming event, and thanks for being on this call. You can reach me if you want to, Dr. Plasker at 100yearlifestyle.com. Visit us, 100yearchiropractors.com. Can't wait to give you a big hug.
Why choose Barber Orthopedics and Spine over a traditional hospital? Our award-winning orthopedic surgeons specialize in all parts of the body. We utilize cutting-edge technology with the most modern advances in medicine. We are on a mission with you to address your totality. We treat the person, not just the symptoms. Your wait is always 15 minutes or less because we value your time. We are privately owned, and we get you the personal VIP treatment you won't get anywhere else. We are a proud partner of the Georgia Chiropractic Association and offer our support to the entire chiropractic community. Barber Orthopedics and Spine, exceptional care you can count on.
Who doesn't like a moment to shine in the spotlight? GCA is always ready to give our members a shout out.
In this month's episode, we would like to shout out Dr. Liana Cart of Atlanta, Georgia. Known as the Queen of Chiropractic, Dr. Cart officially debuted as the first Latin American woman as president of the Georgia Chiropractic Association in 2017. A board of trustee at Life University, a member of Life University's Life Force, and an active participant in the PEAK program, Dr. Cart aims to influence future chiropractors. Personally trained under Dr. Sid E. Williams, founder of Life University, she is sure to pass on his legacy. Anyone who knows Dr. Cart knows she always takes her hard work a step further. Not only does Dr. Cart aim to influence future chiropractors, but she also aims to protect future chiropractors. A force to be reckoned with, Dr. Cart has worked tirelessly as the Georgia Chiropractic Association's treasurer and the chairwoman for the Georgia Chiropractic Association Political Action Committee. With her guidance and encouragement, the GCA has been able to protect the rights of Georgia chiropractors and will continue to protect those rights for many years to come. Thank you, Dr. Liana Cart, for all you have done for the GCA and everything you are presently doing and will be doing for the profession.
Explore the vital link between nutrition, wellness, and chiropractic health. Uncover the valuable insights and practical tips for enhancing your patient's overall well-being.
Good day, this is Dr. Mark Ellis, and we were looking at a journal article today called Microplastics and Nanoplastics in Atheromas and Cardiovascular Events. This article was published in the New England Journal of Medicine on March 7th, 2024, which was just 3 days ago. So it's a nice, new, relevant article. And what they did was they were looking at the emerging potential risk factors for cardiovascular disease related to these micro and nanoplastics. They say that there's not direct evidence to fully prove this, which is true. There's more studies that need to be done. But what did they find? Well, they took a look at about 304 patients that were enrolled in this study who underwent carotid endarterectomy for asymptomatic carotid artery diseases. And they took these 304 patients and they looked at the arterial plaques inside of their arteries. And what they found was that about 60% of the people had polyethylene inside the carotid plaque, and 31 of the patients had polyvinyl chloride in the arteries. Now, there were only 257 people who completed the study, which was to come back 33 months later. So when they looked at these plaques, they used electron microscopy, and they noticed that there were jagged edges of the foreign particles inside the plaque. There were macrophages surrounding the debris. And so we understand that if we have jagged edges inside of our arterial system, our probability of clotting also increases. So these plastics were a form of jagged edges. The people that finished the study had carotid artery plaque, and the ones that had the plastics in it had a higher risk of myocardial infection, stroke, and death within 34 months of the follow-up of the study. So what this study is showing is that if you have plastics inside of your arterial system, you are more likely to have myocardial infarct, stroke, or death. And over 50% of the people that were evaluated had these plastics and polyvinyl chlorides inside of their arterial system. So what can we do about that? Well, we can do water filtration systems. So you can do whole house water filtration systems, and you can do drinking water filtration systems. For the drinking water, there's a debate over whether people would do RO or distilled. I personally like RO, but there is a debate. You can look into it a little bit further. So I hope this segment was helpful for you. We see that we have some concerns about the amount of plastics that are moving through our world. We want to decrease our plastic exposure. We can do that by not drinking out of plastics, and we can do that through water filtration systems. Thank you so much for joining for this brief segment, and we hope that you find it helpful and life enriching.
And now for the moment everyone has been waiting for, starring this month's experts.
All right, welcome back everyone to the Chiropractic Connection. I am your host, Dr. Amber Jackson, and today I have with me a very special guest, Mr. Jason Wasser. Did I say it Wasser right? Did I say it right?
Perfectly.
Okay, perfect. So he's joining us, and today we're going to get into talking a little bit more about the mind-body connection, neuro-emotional technique. In chiropractic, we have this conversation about the three things of subluxation, right? Thoughts, traumas, and toxins. As chiropractors, we do a great job of addressing the traumas. We touch on the toxins, depending on what you practice, but a lot of times we do not get into the thoughts. And so that's why I have you here today, because I really want you to help us explore this a little bit more and see what is that we can do as practitioners. What are some of the different associations we can join where we can learn more about how to tap into thoughts? Because a lot of times we store emotions in our body.
Sure.
It's what causes the subluxation. So Jason, welcome. Thank you so much for being here with me today. And I'm super excited to get into it. You ready?
Me too. Yeah, let's go.
Let's do it. All right. So tell me a little bit about yourself. Tell our audience a little bit about yourself, who you are, where you come from, and how you got to where you're at now.
Absolutely. So, Jason, I'm a licensed marriage and family therapist. I'm in Fort Lauderdale, licensed in multiple states, including the great state of Georgia, which is what this interview conversation is for the GCA, right? And just going through my life as a person who used to work in community, nonprofit education and programming, I realized campus work. I realized that most of my day was actually spent doing informal therapy, and when you're getting paid in a nonprofit, you know that you're not making the world's greatest salary. You're dealing with a lot of boards and a lot of BS of politics and bureaucracy. And I realized at a certain point that if I'm going to do what I want to do, which is helping people at a higher level, grad school for counseling might be the best fit. And the reason why I chose marriage and family therapy, and just so the practitioners, the clinicians that are listening to this know a little bit of a difference in the different licensures that exist for mental health, especially if they're making referrals for any clients, patients that they may be seeing. So marriage and family therapy is a misnomer. We don't just do marriage and families. Really, it's systemic relational dynamics. So it's the person in relationship to anything going on in their emotional reality, whether it's internal or external. The reason why it was called marriage and family therapy is because that's relationship dynamics, right? But it's no different than me in relationship to my career, me in relationship to money, me in relationship to spirituality, and to my health, to a partner, to business dealings, to any type of dynamic that's both an internal and external system. So the whole theory is actually different than traditional psychology, which is looking for diagnosis and looking for pathology, that medical model. Marriage and family therapy traditionally is postmodern in thought, where we don't necessarily look at or look for a diagnosis. That's just the lens. We look for the relational meaning and beliefs, assumptions, and expectations from gender and hierarchy and all those different themes, culture, religion, race, and how it makes sense, and where the authentic relationship is for that person in their own story in relationship to the story that they may have received or been put on them, and help them find the healthy balance between that, and then play that out in dynamics, in health, in relationships, so forth. So marriage and family therapy is a misnomer, but it's actually the only systemic. So it's kind of like when you have a client on the adjusting table and you're doing an assessment, everybody who is a practitioner knows that if there's an ankle issue, it may not be coming from the ankle as a point of origin. It could be coming from low back, it could be coming from hip, it could be coming from their feet, but it could be a foot length discrepancy. But it's not just coming from the point that they're saying this is where it hurts. Marriage and family therapy is exactly similar in that way. We know that the problem being presented is not the problem that probably needs to be solved. And by finding the real thing, the trickle-down effect will be that will actually go away.
Yeah, absolutely. I mean, that makes so much sense. And I think a lot of people have a misconception of that. So I'm so glad that you kind of broke that down and dispelled that myth, really, of what it is, because it's relationships. Absolutely. How many... so how did you get to working with, so you work with chiropractors, you have relationships with them. I know that you attend some seminars with them and things like that. Tell me, how did you find that link between the two? Were you under care or did you learn about it?
So it's interesting. I never, I have friends throughout life that have been chiropractors, but years ago, when I was just around graduate school time, I was in a relationship, and she was going to a chiropractor, and he was pretty holistic on the more, what I didn't know was muscle testing at that time, or, I wouldn't say that it was necessarily applied kinesiology as much as he was doing muscle testing. And he found a long-standing issue where there was some medical stuff going on with my person I was in a relationship with, and she was having major pain during her menstrual cycle. And on one side, you go to the OBGYN and like, oh, you might have this going on for you. And then the chiropractor is working with her, and he's like, oh, well, there's a pelvic tilt, and something's going on with your uterus, has been kind of, so to speak, knocked out of place because of what we know, how the fascia and all those other layers can affect, in that regards. And turns out that was one of the root causes of why there was chronic pain, especially during a menstrual cycle. So having worked and having seen that there was a muscle test that was being done and an age that was indexed for, and she called her mother during the session because she had no clue what happened at the time. And it turns out she fell off a sled and hit her coccyx bone at that age. At like 8, 9, 10 years old, whatever it was. And I'm like, all right, well, that's really cool. It's a shame there's nothing like this for therapists. So, years later, that relationship ended, and I'm having anxiety and panic attacks. And I stumble onto a workshop that one of the people introduced an idea from NET, Neuro-Emotional Technique. Didn't even think about trying it for me because, again, still didn't know that wasn't something just for chiropractors to do. The person didn't explain that. They were a
Right.
chiropractor. And then a month or two later, I got introduced to a therapist who does NET. Turns out I went to an Offspring concert in the 90s with her two twin boys that I'm actually friends with, and did not know their mother was a holistic psychotherapist. Did 3 sessions of NET. My panic attacks pretty much disappeared.
Wow.
The frequency, the duration, and the intensity pretty much disappeared within 3 sessions. And a month or two later, I was at my first NET, Neuro-Emotional Technique basic seminar in Orlando, and that's about 11 years ago.
Wow. That's amazing. I love that you said it's not just for chiropractors, right? So like, I think a lot of people think that NET is our thing, but it's not our thing. It's actually more your thing, right? It's more on the
funny
therapy.
enough, right? But it got created by Dr. Walker,
Yeah.
right? Who's one of the old timers in the chiropractic field, but he's very well known in the AK, right? Applied kinesiology world. Yeah, and his whole thing was, I want to make this accessible to other
Right.
practitioners over the years. But knowing that, like you said, the triad of health, right? It's, thoughts are one of the things that chiropractors talk about, right? I know Dr. Palmer, right? That's where it all comes from, is this whole idea. And the triad of health is such an important thing, but I know that chiropractors are leaving things, so to speak, on the table.
Correct.
Especially with the recurrent subluxation and constant issues, if they're not using this as a tool. And it doesn't mean go get trained in NET. I mean, listen, I think it'll be amazing for every chiropractor to be trained in NET, but it means at least, my big thing is go take a basic, learn how to do the basic by the end of the weekend. But if you're like, I don't want to get into this, you're doing a disservice by not knowing what to muscle test for, and then make a good, strong referral to a good therapist who maybe is an NET practitioner nearby.
Yeah, absolutely. I think you're absolutely right. Again, like I said earlier, we know it's thoughts, traumas and toxins. That we're not even refuting that, yet we don't address it as often as we should. And I even have, and some of these docs are going to side eye me when I say this, but they're like, we're not therapists, and I'm like, well, I mean, I get it. We're not therapists, like literally licensed technically, but we do provide therapies. And part of that is knowing how to address what our patient walks in with, because they may come in with one problem, but they come in with a ton of other things as well. And so if we don't even know the basics, like you said, then how will we know where to go next? Now it then just sounds like, okay, I have this one patient who has all these life issues and they got problems, and every time they come in, they want to talk about all these things. And I just want to get you face on the table, get you adjusted, clear your spine, and send you out the door. But you're back every single week, or every other month, or lifetime, and we still have that same subluxation. So
correct. Well, you're talking about two different philosophies that I'm very aware of in the chiropractic world. Like, there's a chiropractor that's around the corner from me, great adjuster. He doesn't do extremities and he doesn't do nutrition. It's you're in and out in 4 to 6 minutes. And, I know that he's at the point of his career where he doesn't need to work as hard anymore. But it's also what's being left on the table with all the people that are coming in, and he is an insurance-based practice. So, having created strong referral resources with other practitioners over his career may mean that instead of working 3 days a week now, he could have only been working 2 days a week now, right? But also all the other things, again, that I think it's like what's being left on the chiropractic table is kind of maybe the theme of this conversation, where I absolutely love and adore the field of chiropractic, and this idea of like, well, is it therapy? Is it not therapy? If chiropractors want to be known as chiropractic physicians, right, and they want to fight for that identity of being on par, because your training is absurdly difficult and no one should ever diminish that. I know the curriculum. We can get into it later, but I actually applied to Life a bunch of years ago to think about going back to chiropractic school.
Okay.
But I know what your curriculum exists of. I know the worlds of functional neurology and all the other offshoots outside of even the AK world, what is respected and researched and showing life-changing results for people. There's so much still being left on the table that I know that chiropractors can tap into that can bring so much added value just by making that strong referral to a really good practitioner to round out the healing process, as opposed to just saying, well, I'm adjusting you, we're getting rid of an innervation, subluxation theory, right? Life force, vitalism, blah, blah, blah. people need more than that, than just a wonderful theory, which is true.
Right.
But that sometimes doesn't do that. And that's where the home run formula came in from Dr. Walker in NET.
Okay. So let's talk a little bit more about NET, right? Because I'm familiar with it, but I know that we have a lot of listeners who are not. Maybe they've heard of it, they don't know what it is. So can you break it down? Can we go basic level and talk about it as if I don't know what it is, our listeners don't know, just so they can get a good idea and understanding of what neuro-emotional technique is about?
Absolutely. So NET's been around for more than 35 years. We've had our 35th anniversary as far as seminars last year in November. But Dr. Scott Walker and his wife, Dr. Deb Walker, founders and co-facilitators of the modality. But it originally started out with that chronic subluxation that wasn't going away. And if I'm not mistaken, it was another practitioner, Dr. Jennifer LaMonica, who's a chiropractor, I believe, in Long Island, was finding that while a patient was on the table and they were rethinking about a issue that happened when they got injured, let's say it was a car accident, and they were thinking about the moment that the car got impacted, the subluxation would hold. So Dr. Walker, being the mad scientist that he is like, all right, there's something else going on here. He started bringing in, all the AK stuff, a lot of Chinese medicine, 5-element meridian theory, what's going on, what's the real emotion, what's the nervous system, the whole triune brain of where's emotions in the mammalian brain, where's reptilian brain. Well, that's survival. What happens if those parts of the brain are not working in sync? Then you have non-congruency, which is where subluxations can happen, and food sensitivities and emotional dysregulation. And that's kind of where the, I would say the dimensions of NET started forming and bringing in, repetition compulsion from psychology, and stuff like that. And finding that when he would use this protocol that he kept formulating over the years, you would find original events where you may not be actually working on a subluxation, but you're going to see downstream issues where, for an example, like, a food allergy, we know can cause a subluxation, but you get rid of the desensitization. You desensitize that person to a certain food.
Right.
All of a sudden that subluxation is not going to show back up. Right. So I find that that's really, really cool. But then the emotional component really is, as our brain takes in so many impulses and data every minute, every second, we don't know, our rational brain doesn't realize what's going on in our nervous system. And we know that the downstream things, that can cause chronic issues and subluxations, so to speak, in the theory. But how do you stop your nervous system from responding to that? So the adjustment might change or heal the damage, so to speak, that's happening from that last time. That the body has been, so to speak, triggered by it, which downstream required an adjustment, but it's not getting to root cause, which is the original event, where the nervous system is storing it along a theme and along a memory. And that's where NET comes in, so that it retraces that whole pathway, so that it doesn't re-trigger the nervous system away that will cause all those downstream issues.
Yeah, because most people tend to store emotions, right? Something bad happens to us, we put it in the filing cabinet, it goes all the way in the back drawer, whoop, it's all the way back there.
Whether you realize it or not, that's what's happening.
Exactly. And that's the thing. I think people, they're like, I'm fine. But are you fine? You're not really sure. So I had the opportunity when I was a student at Life. Are you familiar with Dr. Bruce Lipton?
Of course. Yeah. Biology of belief. Yeah.
Yes. And so he was there. He was a guest on campus, and I was part of the student ambassadors, and he did a little private seminar with us. So cool. It blew my mind. And so he took us through, a couple of my colleagues and friends, volunteered, and we were all like, we want to go. And he took us through a series of yes or no questions, right? Do you believe that, are you a woman? Yes. Okay. Then the muscle test would hold. But then he'd ask some kind of off the wall questions. And even if somebody said yes, but they would fail the muscle test. And he's like, do you really believe that? And then he'd start picking and going downstream with certain things. It was really cool to see. And I was like, a friend of mine was reminding me when I was telling her about this interview with you. She was like, do you remember when we were with Bruce Lipton and he did that? And I was like, I do. I was like, that's it. Yes, that's what we're talking about today. So
Well, the cool thing about that, right? It's so powerful to see in real time what that's happening. So I want to make it clear to listeners, it's not a lie detector test. It's not like, should I gamble on this horse? Should I buy this food? Should I date this person? Should I take this course? Should I
It's
choose
not
to
a
go to
magic
life?
8 ball.
It's not.
Yes.
It's not a magic 8 ball. Try again
No.
later, right? So it's what it is that it's congruency in the person's emotional reality. And if the person's emotional reality is creating a trigger that is a biochemical, biophysical, neurological response, the muscle test will go from strong to weak, depending on the type of, in NET, the muscle test means different things at different stages. But usually when it's in alignment with, I'm okay going to Life Chiropractic or getting my license or being an associate at this doctor's office, and they think they want it and they're ready for that new adventure, and the muscle test goes weak, that just means that there's something going on in their nervous system that is a physiological fight or flight. So that's just the first indicator. We don't know what that means yet. We just know that there's a trigger. We can't interpret that. And that's where Walker came up with using the 5 elements meridian points on the wrist and the body entry points, which I guess with, the AK, some of the AK body points for the organ systems, where each one has its own set of emotions connected to that point. So then we would muscle test which motion is coming up, which is different than what our rational brain might tell us in narrative. It's how is your nervous system storying that, which is a whole different level, and then creating the emotional reality around that, and where the incongruency or non-congruency comes in of the 3 parts of your brain is what creates that trigger, and then helping fix and heal that, so to speak.
Yeah, that's awesome. So tell me about like what your partnerships with chiropractors look like. I know that you co-manage patients, I guess that would be the best way to say it. So give me some advice on what I could do, because obviously I'm super busy, so I don't have the time. Although I love NET personally, I know I don't have the time to learn it and study it right now the way that some of my other colleagues do. What do you suggest that I do to make sure that I can provide the best benefit to my patients?
Yeah. So there's, I guess, 2 things I would say off that. One is pre-pandemic, when I had an office, I would have a chiropractor come in and rent out someone who I actually met at an NET basic, who never continued going on, but would know enough, like I said earlier, to do a basic muscle test, not an injury-based muscle test, right? Of strength and range of motion, but a the more neurological muscle test for an emotional issue. And would then, if a client was coming up with the same thing over and over again on a subluxation, would send them to me, and then I'd send them back, and everything would evolve. So that's one thing, right? Is even the basic. The beautiful thing about the basic of NET seminar, it's a Thursday, Friday, Saturday, and they have them multiple times throughout the year. And they have them in multiple locations throughout the country. So, they're fantastic with that. The support was that is so much there that even at the end of a basic, you can walk in and start hitting 80% of the issues that are going to come through your door by the end of a 3-day seminar. So yes, there's a certification process and other conferences throughout the year. And some people, like I'm sure, right, some of our colleagues and friends that we both share, and listeners, I'm sure you have people that they're constantly at a seminar for something. NET has its own little ecosystem, but you see the practitioners that are big funk neuro people, or they're quantum neurology people, or they're CRA people. They're a lot of them, or they're big in nutrition, and they might be doing Dr. Leibowitz's protocol. A lot of it is once you're in that AK world, there's a lot of overlap, which is kind of cool. And me as a therapist, I know who to refer to, and I know who not to refer to. So, earlier on, I have a chiropractor. If someone just needs a clean, straight adjustment, I'll refer them to the guy that's around the corner from where I live. That's across the street from my old office. If they need something a little bit more advanced, then I am looking to someone who has a background in applied kinesiology, who has a background in at least a bare minimum of maybe contact reflex analysis, for sure NET, if I'm not seeing them for NET. Any biochemistry, functional medicine is a huge thing as well. So I would say, as a chiropractor, for anybody listening, there's so much out there that, again, I do believe that maybe the theme that's coming up is what are we leaving on the table to help our patients? And if we we don't have to have our ego have to do it all. I find that there are practitioners who just do too much and therefore they leave stuff on the table because they never master a modality. But I think that it's like knowing what you're most passionate at and then finding people you love and trust to refer to. So I just sent a childhood friend to a an acupuncturist who's trained in contact reflex analysis, who's trained in Leibowitz, right? So doing AK type stuff as an acupuncturist, right? Who I don't necessarily want to see for NET, and there's stuff that I can't do because it's a chronic, but I also know that that person will be better facilitated by an acupuncturist than a chiropractor right now. But there are times where I refer straight to chiropractors who bare minimum have to know AK or at least an AK related modality.
Gotcha. Yeah, that makes sense. Do you guys is there a website? So for like our stocks that are up here in Georgia, is there a place that we can go where we can look up to see what therapists or even what practitioners are part of this network so that, we can have resources? Because outside of the few colleagues that I know, I don't know a lot. Yeah. I'm always surprised when I meet someone, they're like, oh, I do this. And I'm like, oh, that's great. I didn't know that. Let me add it to my list. So
yeah, it's again, go back to the referral thing. It's so important to have a referral network. And I find, this is the BNI, the business networking organization, Dr. Ivan Meisner, he created the idea of giver's gain. And that's where their whole thing is referral-based networking, is finding the people that you love and that you believe. But also, again, we can't do everything. So finding that important network, even if it's a chiropractor who does something very similar to you, but maybe does CBP and you don't. Right. And they might not, you don't know, like it might be a good, just a personality match alone might make the difference in the treatment, right? Doesn't necessarily have to be the specific modality.
Absolutely.
So, I always take that into consideration also, depending on who I'm referring to, but Net Mind Body, netmindbody.com has their certified practitioner registry that are all over the world. And there is a ton of people. So I'm licensed in Georgia as a therapist. NET is not done remote by NET standards. So I'm not doing NET remotely because I live in Florida, but there are NET therapists that I refer to for in-person, or chiropractors that I refer to with a client that I'm seeing for some stuff, let's say an Atlanta client I'm seeing. And I'm like, hey, we had these themes keep coming up. I want you to go see my colleague. She's amazing. Yeah. She's a marriage and family therapist there. She does NET. We got certified together, and we're going to take a break for 2-3 weeks, go see her, come back, and let's see where you're at with the next, peeling away layers. And that's kind of, so even again, as a therapist, I make that referral if someone's
Right. That makes sense. And I think that's so great. I love that you are open to doing that. I find that it happens in pockets in our community as well, where I have colleagues that sometimes I don't have the therapy that I need in my office. And I'm like, hey, I need you to go over here for like 6 weeks. And then they're going to treat you for this. I'm going to treat you for this. We're going to co-manage you. We'll see you back over here. So I love that happens in your world as well. I think that's amazing.
Well, that also inspires major confidence in the patient in knowing that you're looking out for their best results. And that's right. If a client's coming in 47 out of 52 weeks a year, and it's not just for management, right, or just get the maintenance of just getting the nervous system back online, and they're still struggling, and you're not taking into consideration who else is out there that I know,
we're doing a disservice.
We're doing our ego is in the way of that. And I think that's where, practitioners get stuck in my field, especially, in all helping fields, I guess.
Yeah.
I see it often in my
Absolutely.
In my world.
Yeah, absolutely. Two sets of eyes are better than one. And so, you're going to look at things different. So I absolutely love that. Now, how do you use your services in Georgia since you're licensed here? Or what do you do? Do you do like Zoom meetings? What does that look like specifically for you? I'm interested.
Yeah. So, the niches that I work in are emerging professionals. I do work with a lot of medical practitioners. So it is, the family dynamics, the life dynamics, career, stress, anxiety, what we would call the worried well. A lot of good things are going on in your life, and you need a good therapist that, I kind of joke that it's a mixture for people who are in the entrepreneur space or watch certain TV shows. I joke that it's a mixture between like Tony Robbins meets Gary Vaynerchuk meets Dr. Wendy Rhodes from Billions, who is a business performance psychologist. So I do a lot of that with like helping people with their businesses and working like with their family dynamics or, again, like
so
just
you're the
life stress.
practitioner's therapist.
I'm the practitioner. I do a lot of that with like entrepreneurs. So right, as a chiropractor, even if you're an associate, you're still being an intrapreneur because you still need to manage, some level of letting people know you exist. But I love working with the therapreneurs, those that are in the therapeutic world that don't realize that they are business owners, even if you, again, are an associate and you have no desire to ever opening up your practice. But, by the Zoom therapy, and then I'll do, if they do need NET, and I happen to not be in town, which I do a couple times a year, then I do have my referral system. And no different than I have a client that moved to California, that we moved from the therapeutic stuff to now it's really a lot of business related stuff. And they see, an old timey AK chiropractor, who's been practicing AK for 40 something years. And they just go for NET to see them. And when they need me for the business and life stuff, for the more the coaching side, it's not then they come to see me for that. So so that's
I love that. We'll have to make sure that when you're up here, maybe we can get to a GCA event. Maybe the timing works out so we can introduce you face to face to everyone, because that'd be amazing. Okay, absolutely. So a little birdie told me, and we can get into this as much as you want. I don't know if I'm spilling the tea or some secrets, but you do hypnotherapy?
Yeah, I no longer do hypnotherapy, so I'll be more accurate. So this is going to kind of go back to me being a advocate, an ardent advocate for NET. One of my professors in my graduate school, Dr. Douglas Flemings, is a big deal in the marriage and family therapy, not only in academia, but also in hypnosis. And he's basically, that next generation. So like, we have like the people like it's like the student after student after student. You guys have that big time in the chiropractic world, right? So, it's the people who are hanging out with Dr. Ellis, and Dr. Ellis hung out with Dr. Cat, right? It's that whole, lineage of shout out to Dr. Ellis. So Dr. Flemings is like, he was a guru, and he was like, we're in awe when he was at the time one of the professors in my graduate school, and I took his hypnosis training, which was like multiple weekends and multiple hours and like really intense. And I did it for a bunch of years, and then I found NET, and I'm like, what the hell? Why am I even? In 2 to 3 minutes, sometimes I'm finding stuff that has never been brought up in therapy versus 20, 30, 40, 50, 60 minutes. Sometimes maybe even having to have a client in my waiting room wait longer because I can't pull the person out of hypnosis, a hypnotic state. And finding that the muscle test is such a underrated, powerful tool. That when it's organically in the field for you guys as chiropractors, that to not leverage this as a powerful, going back to what we're talking about, like, well, but is it therapy? Is it not therapy? Is it whatever, right? You're dealing with the neurological system. So if you leave it at that, we're not getting into talk it out. You're getting a snapshot. You're getting a component of what they're going through. So the physiology is coming up so they can identify and maybe even verbalize, I say that this and this is correlated. You're not doing the talk it out. You're raising the physiology. You're enhancing the physiology, which helps the muscle test, right? And which helps the, bring up, that experience for the patient. But I really feel bad that I'm looking at my shelf here and I have all my, Milton Erickson books and my, and it's amazing for people who don't know how to do AK muscle testing type of techniques.
Wow, that's powerful to say. That's huge. I mean, that's a whole, wow. With, for NET, what is the best way to access it? What's the information? How do we find it? I know you dropped a link earlier, but would you mind kind of stirring us back to
I'll walk people through the basic process. So they just, over the pandemic, they created like a Net Essentials workshop online. It's a couple hours. So I think it's like it's either $200 or $300. So you don't have to leave the comfort of your laptop or your iPad or your computer. And it basically gives a crash course overview of the dynamics of NET, the clinical assumptions, the research, showing a muscle test, showing a few sessions, showing the meridians. So, it's kind of like the intro to a basic, where if someone is already familiar with neurological muscle testing, right, they're coming out of chiropractic school, they don't even have to be doing an AK club, but they're doing right muscle testing for injury, assessment, then they already have enough to go by. And even if they're first, before you even get into clinicals in your school, because I know you do it not right away, it's still basic enough where they give you a crash course where you can kind of have a basic understanding of how to do a muscle test and how to do an assessment to say like, okay, I need to refer you out, or here's the first aid stress tool, which is something that you can do at home by assessing the different meridian points and just going through a type of, it's not a full NET session, but it's kind of the first aid stress tool. So I would say if someone's not, ready to invest in a 3-day basic, if it's not near them, right? I know that every once in a while at different chiropractic schools, they'll do a full-on seminar that will be equivalent to a basic. So I would say that workshop that's fully online, that can be accessed by calling NET, and registering for that could be done. And, you don't have to sit there and do it in one shot, right? It's easily accessible for someone over multiple hours. I think it's 5 hours, maybe 3 to 5 hours, right? It's nothing longer than that. So that would be number one. Number two would be going to a basic. But even before that, if you have an NET practitioner near you, ask them if they'll, ask them to do a 2-minute demo on you, and see what that's like to have something of our own worked on, whether it's a mind entry and I'm okay with something that's going on in our world, or a physical body entry. And me as a therapist, the amount of body entries that I do now, it doesn't mean I'm adjusting it. I'm not doing any diagnosing and assessing from a chiropractic standard. I'm not working on subluxations, but there are times where I'm working on like a frozen shoulder that's not going anywhere, even after orthopedic surgery and rehab and PT and stuff like that. And a client was in a sling for 2 years. 8 minutes later, they had full return of range of motion, and the sling was in the garbage. So
you better. What? Wow.
That's the simplicity and beauty of the protocol.
Wow. That's huge.
Huge. So again, what are we leaving on the table? I'm just speaking for me as therapist, right? When people are like, oh, we can talk it out. We're going to do hypnosis. We're going to do EMDR. We're going to do tapping. But that doesn't get into the original event of what we call, a neuro-emotional complex in NEC, right? We're still dealing at, the top layers. We're not getting to, always to root cause. All those things happen. Everybody should do EMD. I'm not knocking them. I'm not, I think, but I do believe at this point in my career and this point of research and everything that NET is publishing, it's far more, it just works. And it works with simplicity.
Yeah. Sometimes those are the best things, right? We just keep it simple. And the mind and the body is an amazing tool. When you learn how to talk to it and learn how to get responses from it, the feedback from it, there's a lot of things that you can do. And I think this is incredible. Just hearing this information again, I think the last time I really heard it, I was a student and inundated with all of the things. So to sit back and recall all of the moments when I was in school and seeing things over the years, I'm like, wow, okay, I need to get on board with this a little bit quicker.
Yeah. Well, what I realized is when I went to Life Leadership Weekend, they do an amazing job for their recruitment. And I was, they fly someone, if you're part of the Life Force, practitioners and you have a connection, they do a little bit more for the people that they're referring over. And it was like, how could you not want to go to chiropractic school after that weekend? I'm talking to people, and some of them were never even adjusted by a chiropractor. They just heard it was a good field where you don't necessarily have to work so hard and you can make a lot of money. And I'm like, and then the other people were like, die hard. I've been adjusted since I was a little kid. My asthma was gone, or I'm 3rd generation chiropractor and there's obviously nothing else I'm going to do type of thing. So it has that range of things, but there is a lot of yay, rah, rah about the chiropractic field that is so beautiful, where we think just an adjustment is enough. And it is for a lot of, I would say for a massive amount of things, a good adjustment is going to change people's lives.
Right.
But I found that being an outsider, meaning not a licensed chiropractor, meaning being a clinician and preaching a modality that was born from chiropractic to chiropractors, is that experience that I'm hearing from you in our circles of NET and all those other things. Like, this is like a dime a dozen what I'm sharing with you. This is like, yeah, of course that happened. Right.
Right.
But for chiropractors who don't tap into these tools and they get that return back onto their field of why they became a chiro in the first place, that's what I find exciting for me, is like, yeah, this is coming from your own culture. This is coming from your own people, and you have outsiders who have joined. Just a little history, and as something I found really cool. The first mental health practitioner of NET is Mark Vos. He's a mental health practitioner, and he was the school guidance counselor for the New York Chiropractic College. And a chiropractic student went to an NET seminar and told them about it, and somehow the powers that be at that point, there was no other licensed professions allowed to NET at that point.
Right.
And that's what started. And he went to this person. He's like, I think you're into all this holistic stuff. You should check this out. And that's kind of how the mental health field started becoming. But it started off with a mental health practitioner, happened to be working at a chiropractic school, being introduced to it by a chiropractor. And now we have all this amazing clinical research coming out of Jefferson University. That's brain scans and MRIs and blood draws and changing interleukin factors and inflammation markers and and that's all just about a low back pain treatment.
Wow. What you've laid some heavy things onto me today. I want to say my mind is blown, but I'm not surprised. I knew this was going to be a great conversation because I know how amazing NET and that world of muscle testing and AK is in general, but it's really good to hear it again and be reminded of its history of it, because I think that's the part that we maybe have lost sight of. And in school we have the clubs, but we really don't have it in our curriculum. So I think it's interesting because we again talk about thoughts, traumas, and toxins, only educate on traumas and toxins. We do not touch thoughts in school. Very minimally, we don't touch it. And here we have a whole, therapy session, or I guess technique, I should say, that we should be part of our protocol.
Right.
Easily.
And taught in the curriculum, right? Whether it's
correct,
more of an extra credit course, or it's part of guest lecturing.
Yeah. And we do have the guest lectures. I do, like I said, Bruce Lipton was there that one time, and we have AK clubs, and I think this was post-COVID, NET did a free seminar for the students, a level 1 free seminar for the students. And I was so mad I couldn't go. And I was like, no, because it just didn't work. My timing didn't work out. It wasn't that I wasn't eligible, but I heard it was packed. So,
I'm sure that, the NET practitioners at Life are some of the most passionate advocates. One for chiropractic, but two for the, the triad, the triune, the theory of including thoughts. And some of them that have gone to Life are now close friends of mine, and they're exquisite practitioners and passionate advocates for health. And it's so cool to see. And it's funny though, like going back to that story about when I applied, all my friends who were in Life at the time, when I was thinking about, you should come, it's amazing, come be a chiropractor, you're gonna love it, you're gonna love it. And all my friends who are already chiropractors are like, just hire a chiropractor in your practice. Partner with a chiropractor in your practice. Don't go back for the student loans and another, and put your career on hold for 3.5 years. And that's what I ended up doing. And I always joke that if I win the lottery, I'll probably go back to chiropractic school for fun.
Come on,
or my next incarnation, but it really is that, the shared resources, that mental health, we didn't get into addiction, which we can do in another time, we can get into it, but it's all the same stuff. It's trauma and triggers that the nervous system is being compelled to do in habituation. right?
Abs-
It's tracing the same process that a subluxation. If you have a person's coming in over and over again with the same issue in the same place, that's no different internally as an external habit
Mhm.
that the person is doing or craving or being drawn to, or, as we would say in the the neurological law of attraction world, right? They're attracting into their world.
Right.
As it is internally, it is externally. So we're, NET can be fixing those external emotional, it's still a subluxation, right? It's just a different,
Right.
it's a neuro-emotional complex,
Yeah.
which is what Dr. Walker calls it.
Oh, man, this has been amazing. I really appreciate you taking this time to kind of chat with me about this. Before we finish, is there anything that we didn't cover that you would love to share with our listening audience that I haven't asked you? Or you're like, hey, I really want you guys to know this before, or touch on. Like, the floor is yours. And
Yeah. Well, I'm just thinking as far as being a practitioner. I said a few minutes ago that even if you're not ever deciding that you want to be an associate or you want to be, a partner in a practice, that you're not necessarily doing the business side, to still learn the mechanics of entrepreneurship, because you're still an entrepreneur. And, at the end of the day, we're always doing sales, and, everywhere we go, we have to, to talk about chiropractic, to talk about therapy. We don't want to use the psychobabble and the mumble jumbo, and, people
Right.
misunderstandings of what your field is, and a lot of what, you only have to come to therapy when there's things wrong with you, versus, the way that I like working is, it's not just that, it's also when you want to make things that are good go great. There's a
Right.
lot of ways that I work on. So I would have people just really, clean up, talking more about what chiropractic means, as opposed to what chiropractic just does. Like, I'm adjusting you and this is affecting the nervous system, blah, 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 blah.
Right.
And a subluxation, right? Finding the way to express that and share that in a way that, is a little bit more like, here's where it can actually change your life. It's not just,
Yeah.
those type of things, but also not being afraid of, even if they're new in their career, to not believe that they know enough to be going and doing social media and marketing themselves, whether it's doing stuff like this. I have my own podcast. I'm about to hit episode 200. And
Nice.
yeah,
Congratulations.
thanks. So it's called You Winning Life, and it's psychology, it's integrative medicine, it's entrepreneurship. It's now going into a lot of the world of psychedelics and plant medicine for healing. But I've brought on people in the AK world, and Dr. Walker and Dr. Monty, who's an MD psychiatrist from Jefferson. So don't be afraid to use your curiosity to get in front of other people. Even if you want that information, record it just like this, and then, put it out as a social media clip or as a podcast clip, or because
Right.
people don't know you exist if they don't know you exist.
That's right. It's a great point. Speaking, before we end, and you brought up a great point. I personally, again, I'm going to get the side eyes for it. I personally don't love watching adjustments online. It's not one of my
Sure.
favorite things to do.
Yeah.
Although I don't know, something very sacred and special about it. How do you feel about that in your world, in terms of NET and muscle testing and things like that? Like, do you see that happening as often? The TikTok docs are definitely a thing. We'll see what happens once TikTok goes away, if that,
Sure.
is what's going to happen. But
Right. Kind of hoping it does. So it's yeah.
yeah,
But it's no, and I know, and I do follow some of those people, and there are people who are doing it tastefully,
Mm-hmm.
and then there are people that make it look like an OnlyFans.
Right.
And
That's
you
right.
want to figure out which side that you want to be on. And,
Yeah.
if you have to sell your, listen, God bless someone who's very good looking, and, that's their niche, and they're selling that through their funnel of, the skill. Yeah, I know that good chiropractors do good chiropractic.
Yeah.
And if you are good at your skills and you're good at the basics and you know how to adjust, then, obviously all the tools of using an activator and, using a table that, a drop table and all the other cool things, and Graston and all the other cool stuff that you can learn without having to go even into the AK world, right? If you know how to adjust, then, but talk about, don't tell me why you're doing these things. I want to hear why you're passionate about this. I want to talk about anecdotal stories. You don't have to talk about you don't have to show an adjustment. Talk about, without obviously identifying markers of a patient, make it as, and if you're not sure, run that script by a colleague. Talk about, this is a thing that I've been working on. This is a case that I've been seeing for 6 months. They've gone to 6 other practitioners. They were in a car accident, or they had this, or they fell, and here's what's going on. And, here's what we did. And if you're seeing a doctor Are they doing this for you? Ask them, and if you're not sure what that means, this is what that means. This is what this looks like. This is what standard of care should, right? There's so much of the psychoeducation component alone that if you're doing they talk about doing your weekly meetings in your chiropractic office.
Right.
Just break that up. If you're doing the same thing over and over again every week in your office or every patient education session, that should be on video. And that should just be what your patients are watching instead of you having to sit there as a session.
Right.
To do that and just put that on put that on YouTube and say, hey patient, I need you to watch this in my waiting room while you're waiting.
Yeah.
I used to have a playlist in my waiting room in my old office, and all it was Mind Body Bruce Lipton stuff and Joe Dispenza stuff and some NET research and Esther Hicks Law of Attraction audio, and it would just be like their captive audience. Don't have the news on, don't have daytime TV on.
Outside world.
Create that playlist where you're getting them in that funnel of thinking in the positive ways and educating them while they're a captive audience sitting in your waiting room.
You're absolutely right. You hit it on the head. Can you tell our listeners, if they have questions, how to find you?
Sure.
How to listen to your podcast, all of your information that you want to share with us, because I think you might be getting some phone calls or at least an email.
Happy to answer anybody's questions and set up a Zoom with them. So number one, easily Jason Wasser, LMFT is my Instagram. It's also the YouTube channel. There's, all this stuff that's my podcast is on YouTube. It's called You Winning Life. So any podcast platform, if you type in either my name or You Winning Life podcast, it'll show up. It's a cartoon version of me. So you know that it's a cartoon graphic. So you're on the right spot. But yeah, I mean, that's Instagram. Again, Jason Wasser, LMFT. My website's The Family Room SFL for South Florida.com. Even though, again, I'm licensed in multiple states now, but easiest way is, like I said, the social media platforms, but happy to answer any NET questions, happy to get you in touch with the right people. If you're looking for referrals.
Jason, thank you so much.
My absolute pleasure.
I enjoyed our conversation. I feel like I could offline talk to you so much more. I think I need to hire you to be my therapist. All is well, but I want to take good from great. I want to go from good to great. So I love when you said that. So I'm like, and people, if you're listening and you don't have a therapist, which I currently don't have one, but I am never opposed to becoming a better version of myself. So you might get a phone call from me because let's uncover some things. I'm ready to take me to the next level, Jason. Let's go.
Right. And I'll finish just with this statement of we get the life and the business and the relationships up to the amount of work we've done on those particular topics. So if our business isn't going well for our, if we're not getting those clients coming back, then what's going on in our bedside manner? What's going on in our business management? What's going on with hiring and firing our staff? And at the end of the day, it all goes back to us. So whatever that we are feeling that we're worried, concerned, or stressed out about, if it's not working out for us in a particular area, there must be some work that needs to be done internally in order to be able to access more success in that area in order to change what you've been doing. And that's where the beauty of all this stuff that we've been talking about shows up.
Absolutely. Absolutely. As my 11-year-old would say, period.
And mic drop, right?
Mic drop.
No cap. Nope.
Right. I still don't know how to say the cap, no cap thing. I'm like, is it a lie? Not a lie? I don't know. They're a whole different breed of people. All right, everyone. Well, thank you so much for joining in with us. Again, I'm Dr. Amber Jackson. This is Jason Wasser. We have made another connection on the Chiropractic Connection. Look at the links down below to tap onto everything that he sent you, and all the links that are there. We'll have them posted for you. Thanks so much, and we'll see you next time. Our executive producer is Dr. Amber Jackson. Our hosts are Dr. Amber Jackson and Dr. Deborah Little. Production staff is Communications and Events Coordinator Sequoia Gonzalez. Our podcast speakers are Dr. Patience Canty and Dr. Mark Ellis. A special thanks to podcast founder Dr. Noel Stiley and Public Relations Chair Dr. Nyla Smith.